just see if anybody can let us know that you can hear us okay in the chat box. Yes, okay, great. So I'm Dr. Joanna Wozniak-Brown, and I'm the Assistant Director of Resilience Planning at the Connecticut Institute for Resilience and Climate Adaptation. I'm pleased to welcome you to the first in a series of webinars about climate change and public health. Our panel today consists of John Truscinski, the Director of Resilience Planning at CIRCA, Dr. Laura Hayes, Epidemiologist with the Connecticut Department of Public Health, and Dr. Laura Bozzi, Director of Programs at the Yale Center on Climate Change and Health. To key us off, I'm going to invite John to speak in just a second, but if you have questions throughout the webinar, please post them in the chat box, and we'll answer them at the end of the webinar. And as a reminder, you'll be able to access a recording of this webinar on our YouTube page following the event. All right, so John, I welcome you to kick it off for us.
All right, thanks, Joanna. So as Joanna mentioned, my name is John Truscinski. The project director for a project called Resilient Connecticut, which is funded through the National Disaster Resilience Competition and in partnership with the Connecticut Department of Housing. And Resilient Connecticut, you can find out more about Resilient Connecticut on the website, resilientconnecticut.uconn.edu. And the goal of that project is really to develop a climate adaptation plan, a regional climate adaptation plan, or a series of plans that sort of are more than the sum of their parts and that fit together. The work is mostly focused in Fairfield and New Haven counties due to the stipulations of the grant from HUD. So, and a lot of what we're doing through that project is about understanding the impacts of flooding and sea level rise on infrastructure on the coast in Connecticut. And a lot of our research capacity at CIRCA has been making strides in that area. But from the very beginning, we've been trying to better understand how we can incorporate this issue of public health and climate impacts on public health into planning and ultimately taking action. You know, a lot of times when we talk about resilience, we think about infrastructure and flooded roads and people's homes on the coast, but in some ways that obscures the reality that climate change is a public health crisis that affects all of us, and not just in some other place around the world, but in Connecticut. And a lot of what we've been doing is trying to really dial in what climate change impacts are going to mean for our state and our communities. And so this series of webinars was really envisioned as a one-day workshop where we would have a chance to talk with subject matter experts on a number of key topics. And we would be able to incorporate some of that discussion into our planning process. So we, like everything else in the world that was disrupted in the spring of 2020, we've moved this to a different format. So this mini webinar series. So hopefully this will be a good way for us to have a discussion and maybe bring people together, make some connections, and go from there. So with that, I am going to pass it back to Joanna or to, I believe, Laura Bozzi. Are you going next?
Yep, Laura Bozzi is next. Thank you very much, John. Appreciate it. Oh, I forgot to mention that John already covered it. We have a great mini series coming up the rest of our, so check out our webpage on resilientconnecticut.uconn.edu to register for the rest of the series. All right, go ahead, Laura.
Okay, great. Well, thanks so much, Joanna and John, for having me. I'm glad to have this opportunity to speak with you all about the impacts of climate change to public health in Connecticut. I'm based at, next slide, please. I'm based at the Yale Center on Climate Change and Health. Through research, education, and public health practice, we aim to contribute toward addressing climate change, one of the most pressing public health issues of the 21st century, as John mentioned. While we work globally, we also focus in particular on our home state of Connecticut. Next slide. And in fact, this week, we are releasing a comprehensive report on climate change and health in Connecticut. The report covers 19 indicators across, same slide. Great. 19 indicators across 4 domains: temperature, extreme events, infectious disease, and air quality. And you can see a list of the indicators to the left. The report's purpose is to inform policymakers, health professionals, advocates, residents, you all on this webinar about the impact of climate change now and the future on human health in Connecticut. We developed the indicators using publicly available data. In most cases, we report trends at the county level. I'll review some of the indicator results in this presentation, and I invite you to download the report when it's available on our website. Next slide. So since I'm the first presentation in this series, I just wanted to quickly summarize projected climate change impacts in Connecticut, and these are largely drawn from UConn and CIRCA research, so very appropriate. Under a high emission scenario, which is essentially a business as usual scenario, we are expecting to see by mid-century projected temperature increases of 5 degrees Fahrenheit, annual precipitation increase of 8.5%, especially during winter and spring, leading to greater flood risk and greater drought risk in the summer. CIRCA recommends planning for 20 inches or a half meter of sea level rise by 2050, and then continued sea level rise afterwards. And Atlantic hurricanes are expected to become more intense with more precipitation. Next slide. Next slide. And while climate change affects everyone, we know that it does not affect everyone equally. It's sometimes called a risk amplifier. Some people are more vulnerable because of where they live or work, their age or their race, their health condition, their socioeconomic status, and you can see this depicted in this graphic. The graphic also shows that adaptation actions can be designed specifically for vulnerable populations, and that in our policies, we need to prioritize these vulnerable populations and also understand what makes them vulnerable to develop the best targeted effective solutions. Next slide. So we'll move on to the report findings. The first domain is temperature. Next slide. In Connecticut, average annual temperatures increased 3 degrees, over 3 degrees Fahrenheit across Connecticut and in each county in the last 125 years. So what does this mean for health? High heat days can cause heat-related illness, heat stress, heat stroke, and even premature death. Warmer winter temperatures creates a more conducive environment for larger tick and mosquito populations active over a greater proportion of the year. A longer season for pollen, which causes hay fever and exacerbates asthma. High temperatures also interact with air pollution, particularly ground level ozone, which can trigger asthma as well. And I'll flag here that in our analysis, another one of our indicators was on extreme heat days, and we didn't find a significant change in the number of extreme heat days, days over 90 degrees from 1950 to the present, but models projects that extreme heat days will increase as climate change progresses. Next slide. Extreme heat stresses the body's ability to maintain its normal temperature. The resulting heat-related illness may require emergency medical treatment or hospitalization, and in severe cases can lead to death. In Connecticut, there was on average 422 ED visits and 45 hospitalizations for heat stress in Connecticut over the last decade or so. Vulnerable populations include the old and the young, those with pre-existing medical conditions, those with social and financial resources that are limited, outdoor workers, and athletes. You can also see to the right this depiction of the urban heat island effect in Connecticut. It's hotter in urban areas, and this can put those living in cities at greater risk, especially if they have low financial or social resources to adapt. Extreme heat can also have other indirect effects. Studies suggest that extreme heat events may be accompanied by an increase in aggression and violence, Heat waves can also limit outdoor physical activity, reducing not only exercise, but also opportunities for social connectedness. Next slide. From here, we'll move on to extreme events. Next slide. From 2010 to 2019, there were 9 federal disaster declarations for weather events in Connecticut, compared to only 13 in the previous 56 years. And in this last decade, that included Hurricane Sandy, Tropical Storm Irene, and the hurricane and the Halloween nor'easter. In terms of the health effects, of course, there's immediate dangers from severe storms and flooding, including drowning and injury. Road flooding can also cut people off from safely evacuating. Disruptions can occur to critical infrastructure like electricity, sanitation, drinking water supplies, food refrigeration, transportation, communications. And this can interfere with access to medical care. For instance, if you lose electricity and you're on dialysis at home, that can be life-threatening. People who need to evacuate may leave medications behind. Ambulances may not reach someone if the roads are blocked. So there are these ripple health effects that can happen in addition to the direct effects. And then there are also less visible but critically important issues related to mental health. In general, we know that individuals whose households experience a flood or risk of flood report higher levels of depression and anxiety, and those impacts can persist several years after the event. And the building stock in lower income communities is often at increased risk for damage by natural disasters like floods and hurricanes. And this is in part because of historic patterns of development in areas vulnerable to natural hazards, as well as an underinvestment in public infrastructure in those neighborhoods. Next slide. Climate change impacts interact with other existing environmental issues. In this indicator, we reported out findings from the Government Accountability Office on how storms, floods, and sea level rise may affect contaminated Superfund sites in Connecticut. They found that 7 of Connecticut's 16 sites, those marked in the map here, are vulnerable to certain climate impacts, particularly related to flooding. Next slide. Next is infectious diseases. Next slide, please. We conducted a detailed analysis, a detailed assessment of mosquito abundance using data from the Connecticut Agricultural Experiment Station. And we found that for the past decade, over the past decade, of 28 species found in Connecticut to carry viruses that cause human disease, 10 show trends of increasing abundance and 3 show trends of decreasing abundance. And you can see those species in green on the table here. Those are the ones that have significant trends. This is important because mosquito abundance is a key factor that influences the capacity of a mosquito to transmit a virus and the rate at which the infections spread. And each of these species that we tracked carries one or more of the viruses that are listed on the slide here. Next slide. Briefly on tick-borne illnesses, as you can see, there's a nice downward trend here, unlike a lot of the others in the report. And that's that the number of cases of Lyme disease has decreased statewide over the last decade or so, and that's good news. However, there are emerging concerns, and I'm sure that you'll hear more about this in the infectious diseases webinar later in the series. And the one that we highlight in the report is the expansion of the Lone Star tick in Connecticut. The Lone Star tick is the most common human biting tick in the southeastern United States, and it's expanding into Connecticut, likely due to factors including warming temperatures and especially warmer winters. Next slide. Very briefly on Vibrio infections. Vibrio is, we tracked foodborne Vibrio, so that's from eating contaminated shellfish. And you can see here that there's a strong correlation between confirmed Vibrio infections over time and near surface water temperature on the coast of Connecticut. Warm water temperature is a driver of higher Vibrio infection, of higher Vibrio, which leads to more Vibrio infections. Next slide. The final issue area is air quality. You may be aware that Connecticut has issues with ground level ozone pollution. And in fact, the American Lung Association gave each county an F grade for ozone pollution in its 2019 report. We found that while the number of air quality alert days for ozone have decreased over time, as you can see in the figures here at the county level, more needs to be done to protect human health. Ground level ozone is the result largely of burning fossil fuels, whether in our vehicles or in power plants. So this is where we see the strong health co-benefit of climate mitigation or of reducing our greenhouse gases. When we switch to cleaner energy sources, we make active transportation safer and easier. We also reduce these drivers of local air pollution. Still, it's worth noting that our ozone pollution blows over from states to our west to a large degree. And so this points to the need for strong federal and regional action to address climate change and air pollution. Next slide. Finally, our last indicator is on aeroallergens. We use data from a monitoring station in Waterbury to track mold and pollen concentrations. These allergens can cause respiratory issues, including seasonal allergies and exacerbation of asthma. We found that days with high mold concentrations have increased. That's the top left of those figures, though we didn't find a trend in the pollen data. However, there are some national indications of changes in pollen exposure that might be associated with climate change. Increased atmospheric CO2 concentrations and warmer temperatures appear to have changed the geographic distribution of allergen-producing plant species, as well as increased the length of the pollen season, increased the amount of pollen that it's produced, and have possibly increased the potency of the pollen, making for stronger allergic reactions. Next slide. So that was a fairly whirlwind overview of our report. I encourage you to download it when it's available from our website. You can see the link there. You can also sign up for a newsletter where we'll also include a link to the report, and you can find out more of what our center is up to. And feel free to contact me at that email address with any questions or comments. Thanks very much.
Hi, thank you. We'll
Sorry
go back
about
to
that, Laura.
That's okay.
There we go. I was trying to unmute and I clicked the wrong button. But congratulations, Dr. Bozzi, on releasing that report. I know that your team worked very hard on it, so that's fantastic. So now I'll turn it over to Dr. Laura Hayes from Connecticut DPH for her presentation.
Okay, thank you. And yes, thank you for inviting me to speak about some of the state level initiatives that have taken place recently to address the health impacts of climate change in Connecticut. So this is a nice follow-up to the presentation by Laura Bozzi of those health impacts. I'm going to talk in particular about two initiatives: the state health assessment focus on climate change and the health impacts of climate change, as well as the Governor's Council on Climate Change. And this isn't necessarily comprehensive of all state level initiatives, but those that have been occurring most recently. Before I jump into that, though, I do want to provide just a little bit of background. So next slide, please. To remind everyone that in 2011, there was a Connecticut Climate Change Preparedness Plan put forward. This was the follow-up to a report from before that was a sort of an impacts assessment of the impacts of climate change on health in a variety of sectors within Connecticut. And it was mandated by the Governor's Steering Committee on Climate Change. And that preparedness plan contained a set of public health adaptation recommendations. And because public health was one of 4 work groups that contributed to the plan. Next slide, please. The result of that was the development of 18 specific recommendations to address the impacts of climate change in Connecticut on public health, including best management practices, research, monitoring and education, policy, regulation, and funding. Next slide, please. Between that 2011 plan and present day, as a state agency, there's been limited work on climate change and health. I do want to recognize also the state agencies fostering resilience, which our DPH and specifically our drinking water program has contributed. It was formed in 2015 under Governor Malloy's Executive Order 50. And so SAFER is tasked with creating a resilience roadmap for the state and includes representatives from 9 agencies. So DPH has been contributing since 2015 to SAFER, but only as of Executive Order number 3 is actually on the council, on the Governor's Council on Climate Change at large. Next, please. Additional initiatives that have really been undertaken by the drinking water program, a little bit outside of my scope. We recognized that there was a Connecticut water plan that was put forward within the last 2 years, as well as a drinking water vulnerability assessment and resilience plan that was put forward by our drinking water program in collaboration with state partners, including CIRCA and led by our drinking water program and Lori Matthew, now a branch chief within our agency. So we have these, you know, from 2011 to 2015, and then reports being put forward. Next slide, please. I want to jump ahead to 2019 and the state health assessment and sort of an agency-wide initiative to address climate change and health. Next slide, please. So what is a state health? It's a collaborative process of collecting, analyzing data and information, used in educating and mobilizing communities, developing priorities, garnering resources or using them in different ways, and adopting, revising policies. What you see here is Healthy Connecticut, the thumbnail of Healthy 20, which was the plan that we put forward in 2014 as a state. So, or assessment that we put forward in 2014 as a state. What follows on after the state health assessment is a state health improvement plan. And this happens every 5 years. The first time we did it was in 2014. 2019, we were scheduled to do it again for Healthy Connecticut 2025. Next slide, please. So development of the state health assessment is long-term, about 2 years. As you see, it starts with the development of the work plan and initial key informant interviews. There's a heavy level of community engagement, as well as data inputs and the development of indicators by epidemiologists within DPH. And it was scheduled for release January of 2020. It got delayed a bit until June. Next, press enter, please. So what I want to identify here is that it was pretty late in the process that we had leadership within our public health systems improvement program within DPH to say that climate and health should be included in the state health assessment. And so we were on a pretty short time frame to develop a statement about climate change and health, specifically in Connecticut, to be included in our state health assessment. Next slide, please. And I just want to add here that this was especially a tall order because Connecticut is not one of the states that receives federal funding to address the impacts of climate change within the state. So there are 18 grantees under the Climate Ready States and Cities Initiative funded by the CDC. Those states, most of them have been funded since 2010 and are pretty much a decade into developing their adaptation efforts to address climate change and health, and Connecticut is not one of them. So I've described some initial foundational work, but really compared to the other states, we haven't done the necessary legwork to get us on par with them. But nonetheless, next page, please. We have included in the 2019 State Health Assessment a statement of climate and health, a specific chapter focused on it. I've provided the link for you. It's not comprehensive. We were limited because of the short time frame, but it has the essentials there of being sort of a landmark chapter in acknowledging on a statewide basis that climate change is happening. It's real, currently impacting climate change with public health within our state and predicted to do so in the future. Next slide, please. So as I said, the follow-up for any state health assessment is then a state health improvement plan, and that process is currently underway. Concurrent with that is the formation of the Governor's Council on Climate Change Public Health and Safety Work Group, which I'll finish the talk by describing. Next slide, please. Executive Order number 3 was signed by Governor Lamont on September 3rd, 2019. And this executive order essentially expands the responsibilities of the Governor's Council on Climate Change, which was formed in 2015, and increases its membership, and also provides a number of deliverables that are needed in a relatively short period of time. That increase in membership now includes the Department of Public Health, whereas we weren't official council members prior to that, outside of the contribution through SAFER. Next slide, please. As I said, there are a number of deliverables or objectives that were identified through Executive Order number 3. One of which was the development and implementation of adaptation strategies to assess and prepare for the impacts of climate change in areas such as infrastructure, agriculture, natural resources, and public health, including revising and updating the statewide adaptation and resilience plan that was put forward in 2011. So now we're circling back to that 2011 document. How that update actually looks now has morphed a little bit since the beginning of the process in this executive order, in that much of the work is divided among work groups. But essentially public health is now, and the department is now coming back to provide an update on those recommendations. Next slide, please. The revised structure of the Governor's Council on Climate Change is such that we have an adaptation and resilience subcommittee alongside the climate change mitigation subcommittee. And if you see to the far right, public health and safety is one of the named working groups under climate change and adaptation resilience subcommittee. We were later to form, actually, even in this process. So we've only been active as a work group really formally for about 3 months. Next slide, please. Okay, so the overall timeline was the GC3 kickoff was December 2019. In early January, subcommittees met, and then the planning and the development of the recommendations was to occur from February to August of 2020. Obviously, this process was, there was a lot of interference from this process due to the pandemic and telework, transition to telework, reassignment of roles, especially within our agency. Public health, this was a challenge, but nonetheless, a draft set of recommendations is now available and going through review as of this fall. And those will ultimately be reported back to the governor on January 15th, 2021. Next slide, please. So as I said, we have work group reports, including a report from Public Health and Safety that's going to inform the final report that will go before the governor on January 15th, 2021. There's also a phase 2 that will continue through all of 21. Next slide, please. In terms of our group, we're represented by over 40 public health professionals, academic researchers, climate resilience planners, health equity and environmental justice representatives, and environmental consultants. It's led by Lori Matthew, the DPH branch chief, former drinking water section chief, as well as myself from Health Statistics and Surveillance, on behalf of our Commissioner Heather Aaron, Deputy Commissioner Heather Aaron. We've identified as a group the planning and implementation actions needed to address present day and foreseeable threats to the protection and improve safety of all people if Connecticut associated with climate change. We've divided our work across 7 domains that you see here, these health impact domains. Next page. And I'll end by saying that our initial work group report came out in August 2020. It underwent an internal review process, and it's due to be released on September 22nd, 2020. So I think I've run over a little bit. I'll stop there and we can go into the question section. Is a sort of a drum roll to say you're going to be able to review a copy in about 2 weeks of our final work group report. So thank you.
Thank you so much, Dr. Yates. Really appreciate that. I'm going to invite folks to enter any questions. I see a couple are coming in. If you have any questions, you can either put them in the chat box or the Q&A box. I can see either of those. But to start us off, I would like to ask Dr. Bozzi about what municipalities should be considering to be protective of human health as the climate is changing.
Great. Thanks, Joanna. Well, I think it matters where the municipality is located, and municipalities are starting to, if they haven't already, done an assessment, even if it's an informal assessment to understand what impacts they're seeing now, and then also looking at resources that might be available from CIRCA or from the state to understand impacts in the future. And something that I think is important also to emphasize is that because climate change is, as I had said, it's a risk amplifier, that it's interacting with the social determinants of health. There are ways that good public health provisions can also benefit us in protecting against the health effects of climate change. So good programs to address air quality are helping against climate change, or good transportation options, good green space and tree canopy cover. Those kinds of actions can also have all of these health co-benefits and address the impacts of climate change. So I think that it's helpful to, I know municipalities look at, oh my gosh, it's another issue to add to my long list of other issues to cover. But I think that there are ways to work on them in concert.
Great, thank you. We have a question from the audience, and Bonnie asks, are estimated costs for implementing recommendations included in the report dated September 2020? I think she's referring to the GC3 report, because it came up at the same time.
So I can answer that, John. I'm not sure if you can also, but no. So they are included with this report, but there's consideration of costs, and that is recognized as the next exercise that needs to be undertaken by the work groups. We have, I just can't describe just the time crunch and the pandemic, and we've been asked for deliverable after deliverable in this process. And so we got the work group report out, and to follow on the heels of that, we've been asked to now start how to ascribe costs with the specific recommendations that we're putting forward. And that's in collaboration with the GCC financing and adaptation subcommittee. I'm sorry if I don't get it exactly right. John, do you have anything to add?
No, I think as in terms of the report of the health and safety working group, I think you covered that. As far as the financing, I know that the financing resilience working group, of which I've been participating, is charged with coming up with how do we pay for the actions and the recommendations that are developed by the various working groups of the GC3. And so that is also a report that will be available in the next 2 weeks for public review. But to my knowledge, specific costs associated with specific recommendations have not been developed yet, and that would be something that would need to happen over the next year as a follow-up.
Great, thank you. I think the main lens for the decision making, at least at this point, for the GC3 was about vulnerable populations and addressing some of the concerns that they're experiencing. So just like John and Laura explained, that the financing part will be the next step, but that we wanted to make sure to address those concerns up front. And that was a big concern of the commissioner, Katie Dykes from DEEP. So our next question is from Peter, and he says, as an environmental activist, arrested but not retained in 1967, your generation gives me hope to keep up the good work. Prevailing westerly winds affect us negatively big time. Air quality in Greenwich is worse than New York City. Is there a concerted effort to return to expansion of stack scrubbing since our success with acid rain scrubbing has been reduced? So I'm not sure if any of our panelists have a specialty in air quality or in regulatory control of for manufacturing. So, do you want to jump on that?
I'll jump in really briefly. I wish I could answer this more fully, but to say that there, the Clean Air Act, there have been changes to the Clean Air Act under the current administration that I think threaten some of the public health benefits that we've seen so far. So that's largely a national concern. And then there are also growing factors that, for instance, our transportation over time has really increased our emissions from our transportation sector. And so there's work at the regional level now to address transportation emissions, both for climate change and also for public health through something called the Transportation Climate Initiative, and that's underway. So I think it's, as Peter mentioned, the stack scrubbing is from industrial sources, but it's also from these distributed factors like transportation, and those are coming from within Connecticut and outside.
Thank you. That's certainly a complicated issue for sure. And we have a follow-up question too, from Bonnie. Will there be an announcement of these reports distributed to healthcare communities such as general practitioners and hospitals? And I'm not sure if she's referring to the GC3 reports or the Yale reports, so we could answer for both.
Well, I'll answer for the Yale report that we plan to send it to local health departments. I hadn't actually planned to send it out to healthcare providers and hospitals, mostly because if Bonnie, if you have a suggestion of how to get the word out, if you know of a good way, I'd love to hear it. Please feel free to send me an email, and we'll be sending out news releases as well.
And I'll follow up with that by saying, so I'm going to answer on two levels, in that most of the information and posting currently about GC3 activities is coming through a listserv, which most of you are probably already signed up on. It's been recognized through this entire process that's happened over the last few months that we want to be doing more community engagement, more partner and stakeholder engagement, but we've been very limited in doing that. And so I don't know if specifically with this report, how it will be broadcast, but there's now a concerted effort between, in collaboration with the Public Health and Safety Work Group, in collaboration with the Equity and Environmental Justice Work Group, and with support from Yale University, to focus on how we can be doing more community engagement to make sure that all of the findings of the Governor's Council planning process get to the right people, so that everyone has the opportunity to consider the recommendations, and that they're presented to them in a fashion that's digestible, and that there's as much feedback as we can. So we recognize that we want to be pulling as many people into this process as we can. It's been really hard during the pandemic, but it's a target for the coming months to figure out better ways to do that.
Great, thank you so much. We have one more question, so we can keep to the idea of the mini webinar. We have a question that says, how can you describe pathways framework for climate change and mental health?
Laura Hayes, do you want to take it? Do you want me to take it?
I'm sorry, could you repeat that one more time?
Sure, I'm sorry I didn't direct it to somebody. I wasn't sure who, I'm not familiar with pathways, but it says, how can you describe pathways framework for climate change and mental health?
So that is, I'm afraid that that's not a specific framework with which I am familiar. As what we've done with the climate change and public public health and safety work group is we've divided our work group members into teams of subject matter experts, including mental health and well-being. The framework of the report is that there's a general description within each of the subtopic teams for general health impacts within the health domains, a statement of vulnerable populations, and then recommendations that focus specifically on protecting most vulnerable populations. I have not seen that pathways framework described within the health impact statement from that team. So I don't think we're using it in our current report. Laura Bozzi, do you have anything to add to that?
I don't know of a specific, I am also not familiar if there's a specific pathway, but I am adding into the, I'm trying to add into the chat box a reference that I've used in the past from Eco-America and the American Psychological Association on mental health and climate change. And it's a useful guide. It also gives some resources. So if I can send that, I will. I'll try to put this in.
The questioner says thank you, and we can put a link to the presentations on our program page too at resilientconnecticut.uconn.edu, and our September 2020 webinar series. We'll put that up there as well. So we are at time. So I wanted to thank our fantastic panelists for presenting. We really appreciate, there's always so many things going on, so we really appreciate your time on this important topic. So I just wanted to also plug the rest of our series coming up. We have HEAT coming up on Thursday at 4 p.m. So make sure you register, and we have a little quick link that's showing on the screen in red in the upper right-hand corner. And then we'll continue on with equity, vector-borne disease, recreational water, and emergency preparedness. So we look forward to seeing you then. All right, thank you very much and have a great day.
Thank you, Joanna.
Thank you. Take care.
Thank you.